Hey, Professor Hudson. My name is Kane Weinbrenner, and since this is the first sort of face-to-face interaction we ever had, I'd like to say it's nice to meet you. Uh, my presentation is over the effects of health technology on expanding and improving healthcare. So let's go ahead and dive right into it. So first of all, why is technology important in general? So I started reading a book on Google, which is a multi-billion-dollar company who has taken technology to new heights. And this quote is saying, "We live in a time where technology is advancing at an amazing pace." And it's also saying that change tends to be revolutionary and not evolutionary. So the fact that technology is moving so fast basically means that we have to keep up. So with healthcare right now, we do a lot of, paperwork that gets filed away, and it's kind of tending to switch to computerized things, but in order for that to happen, you have to scan multiple different documents into a computer, and that takes a long time. I've actually been in a position where I've had to scan so many different documents, and it's a pain in the butt. And the fact that technology is revolutionary and not evolutionary is the fact that revolutions tend to be very fast and take over very quickly, where evolution is very slow, subtle rise. So the fact that it's revolutionary means that we need to be ready for it, and we need to take our time and figure out how to do it right. So what is health information tech? So the use of technology to streamline the everyday issues that healthcare providers may witness with the old system of health info. So the examples that I have written are administrative and financial systems, reminders for vaccinations, adherence to guidelines. So right now, we're at the very beginning of what we want to use health information technology for. So that's administrative and financial issues. That's signing documents when you get into a healthcare provider. That's paying through a computer, anything like that. That's the baseline of what we have so far, and that's beginning to grow into things that could turn into you know reminders for vaccinations. We have those, but maybe getting closer to diagnosing diseases instead of just giving you a reminder of when someone needs a vaccination. Uh, what is needed in healthcare technology to be successful? First of all, this is a management class, so strong leadership is something that needs to be implemented right away. The leader of whatever healthcare facility that uses technology needs to be insightful on what they're telling their staff when it comes to healthcare technology. Uh, a medical staff that buys into the idea of health information technology is also big, because without a staff that believes in what's going on, it's very difficult for that movement to gain any ground, especially if they're not doing anything to help it. Lastly, people educated enough to learn and understand the technology. Uh, you know, People getting older are a little bit less tech savvy, so it's a little bit more difficult for them to understand and use technology. So, as college students learning about this now, we've already got a head start on what we need to learn to advance health information technology to incorporate it in what we're going to do later on in life. The four main goals of health information technology, pretty easy. Improve on quality of care. So quality of care is, what we're doing for patients, what we're doing for people who come to see us. Improve on cost, which is always a big one to patients, and not only patients, but the people who run the company. So cost of what we're buying and also what we are selling to our clients and patients and things of that nature. Improve on efficiency at which care is given. So that kind of goes on with quality. So efficiency is basically talking about how quickly we give the care to our uh, patients or clients or anything like that. And then also increase access and coverage. So that's making sure that everyone has access to what we are providing, and they can understand and move freely with what they need to do. Next is improvement on quality of care. So quality of prevention care rose about 2 percentage points with the introduction of health information technology, and that comes from an article that I use, which is pointed down at the bottom. Secondary care is something that we haven't quite gotten into yet. So secondary care is like while someone's actually in the hospital. Preventative care is like taking medication to make sure you don't get sick. But secondary care is when you've already gotten sick and you've got to make sure you get to the hospital so you can get better. So secondary care is like giving a diagnosis. Technology is not quite up to that standard already. So that's something that can be developed further into the future. Some issues are allowed to be left up to technology. So, like I said, maybe what vaccination an individual needs, or a reminder to do a diabetes test or something like that. Then there are other issues that can't really be left up to a computer algorithm just yet. Some issues that are a little bit more ethical that require emotion and actual thought, and not just a computer algorithm that'll use numbers to figure out what's going on. Improvement on costs. So this one's pretty straightforward. When you're using technology, there's you're paying for technology. There's a cost for purchase, and there's a cost for maintenance. And I found an article that talked about how a maintenance cost is somewhere around $700. But once in place, nothing really changes. Like, you can update an information system to be up to date with what's going on in the healthcare field. And once you have that system in place, you need to hire skilled workers who understand the technology and can use it correctly and efficiently. Efficiency of health information technology. I have one quote, and I feel like it works perfectly. The average U.S. hospital will generate large returns only when it fully implements comprehensive health records systems. So that's not like the full spectrum of health information technology, but it obviously says right here that the returns will come if you fully implement what you're doing with your staff, with your managers, with stuff like that. And once you get those full returns, that's when efficiency starts to get rolling and everything starts to take off. Next, we have Hthcare, which is the health information technology for economic and clinical health. It was put into place to improve cost, quality, and coverage of healthcare, which we talked about earlier. And this was passed alongside the Affordable Care Act. So when Obama decided to make that Affordable Care Act, he wanted to implement Hthcare to make sure that people all over the country could have access to healthcare, and it'd make it easier because as of right now, everyone has some sort of technological device that they can use to get on the internet, fill out paperwork, learn about different healthcare providers. So as we passed that along with the Affordable Care Act, we had an idea of what we wanted to do with technology, and as of right now, it hasn't taken off fully. But like I said, you have to fully implement everything that you believe to make sure that that's going to take off. The three major areas of what one article described for health information technology that need to be focused on the most is registries, team care, clinical decision support. So registries to start is information on patients and possible diseases. And the example I have is patients who possibly have diabetes and need lab tests. So registries are just like running databases of like groups of people in certain groups. So diabetics who need lab tests, there's a registry of diabetics, there's a registry of people who have certain other chronic illnesses and stuff like that. It's a much cleaner way to, sort individuals. Team care is providing individuals who are treated at home with the correct providers, also creating open lines of communication. So team care, when you have an elderly person living at home who doesn't quite need to live in a retirement home but also still needs care, you have to have open lines of communication, but you also have to be able to coordinate who is going to do what and when. And health information technology is something that helps, organize that to a better extent than just, writing it down on a calendar and making sure to get there. Clinical decision support, that is basically narrowing the window of error when treating a chronic illness. So, like I said, we have like minimal health information technology that helps us with, vaccinations and stuff like that. But the fact that you can rely on some sort of technology to help you make that decision narrows down that window of error, so you don't have to rely solely on humans, because human error is usually larger than computed error. The future goals of health information technology, after signing in Hthcare, the goal was to get electronic health information exchange, which is kind of confusing, but health information exchange is basically making sure that your health records are easily transported between clinics and doctors and places where you get health care. That's something that has been trying to be done for a long time. Other countries are doing it, and they're attempting to do it at least, and it's something that I feel like within the near future, with people who are interested in health information technology, could really take off. This would provide a solution for the highly fragmented healthcare system as a whole. So when I say fragmented, I mean like it's broken up pretty much. So you have your physicians, you have outside doctors you go see, like chiropractors or dentists or stuff like that. But no one can easily access your healthcare records from one office to another. It's always a big process. You have to fill out paperwork for each side, and they're not easily transferable between offices. So that's basically what electronic health information exchange is making sure that those records that you have could follow you easily wherever you go and decide to get your healthcare coverage. Uh, health information technology in academic hospitals is actually one of the largest places that it's found. So an academic hospital would be like the University of Missouri Hospital. So in academic hospitals, the use of health information technology is larger than most other healthcare institutions. They have seen large increases in vaccine administration and initial antibiotic use. So like I've said earlier, those baseline tests that we do with health information technology to figure out if we can implement it further into diagnoses and stuff like that, these academic hospitals have seen large increases in the ability to do that with health information technology. Uh, the landscape of HIT right now, so adoption is very limited because it's still an unknown frontier. We've done minimal use with. We've done minimal use with the technology so far. Like I said, we've done vaccines and administrative tests, but that's about it. So, like I said earlier as well, you have to have full support from staff and from leaders who are going through that healthcare system to make sure that people start to figure out to adopt that, because sooner or later that's really going to take off and it's really going to improve the whole landscape of healthcare. There needs to be a large increase in financial resources. So financial resources could go towards buying the technology. Financial resources go to educating people, go to schools so people can learn all sorts of things. Implementation of incentives for clinicians to use HIT. So it comes to the point to where we are incentivizing people to use it. So we're doing the necessities to make sure that we can start to push this forward to make sure that it starts to work and starts to take off in the future. Like I said earlier, total buy-in from HIT to work. So you have to make sure your staff is on board. You have to know that they're educated in what they're doing and they understand what this process is going to do for your company as a whole. And a lack of generalizable knowledge on HIT to begin implementation. So as of right now, not a lot of people know what's going on, which is common when you introduce something new, which is why there are people like me who go to school to learn about these things, to know what I'm getting myself into when I graduate and when I join the workforce. Health information technology in other nations has been explored a little bit more. Health information technology adoption was studied in 7 nations, with the US and Canada having the lowest rate of EHR, which is that electronic health record usage. Other countries have decided that that is what's worked best, and as of right now, us in Canada haven't really gotten on board with that. But even though we lack in that, all other nations lack in health information exchange and inpatient EHR. So that health information exchange, where your health records are easily transferable between different clinics and things like that, is still something that hasn't caught on worldwide yet. An inpatient EHR is just the paperwork that you do inside the clinic, but that's about it. Final thoughts on the topic. Health information technology is on the way, whether we are ready for it or not. So it is highly recommended that we learn how to use it and we learn how to implement it, because if you fall behind on the rapidly changing technological fields, like Google said, it's moving quickly at a fast pace, and if we fall behind, it's going to be very hard to catch up. Soon it will be mandated in most healthcare facilities. So, like I said, whether we like it or not, it's probably coming. So we need to get ready to do that. Implementation may be more successful as staff knows that leadership, project management, training, and standardization of terminology could aid in health information technology taking off and turning into what it's meant to be. So going back to what this whole class is about, healthcare management, staff knowing that the leadership they get, the project management that's placed in front of them, the training they receive from their leaders, and a standardization of what everyone uses. If they understand that that's going to happen, that could, create leaps and bounds for what's going on. And that'll help them get on board fully, which is what I've said multiple times. When someone's on board fully, that's what we need for health information technology to take off. Here's my citation pages, and that's all I have to say about that. So thank you very much.